3 of the 5 medications I'm about to discuss do not require a prescription. You can walk into almost any pharmacy today and purchase them over the counter. And that's exactly what makes them risky for individuals over the age of 70. When something is easy to access, we often stop treating it like a serious medication and begin to assume it's harmless. But for a body that has crossed the age of 70, that assumption can be the difference between living independently and ending up in a hospital. Here's something that often isn't explained clearly during a short doctor's visit. The way the human body processes medications changes significantly after 70. The kidneys remove drugs from the bloodstream more slowly. The liver also breaks down substances at a much slower rate than it did decades earlier. At the same time, the brain becomes far more sensitive to sedatives and anticholinergic medications. A dosage that felt safe at age 55 can now lead to falls, memory problems, kidney issues, and even cognitive decline that may be mistaken for early Alzheimer's. Today, I'm going to walk you through 5 specific medications that highlight this issue very clearly. All 5 are listed in the American Geriatrics Society's Beers criteria, a medically reviewed and regularly updated list of drugs considered potentially unsafe for older adults. This is not alternative medicine. This is well-established, mainstream geriatric guidance. I'm Dr. Olivia Collins, and this channel is focused on turning current medical research into practical, easy-to-understand information for adults over 60. If you haven't subscribed yet, make sure you do. We share new evidence-based content every week designed specifically for you. Now let's begin with these 5 medications, and more importantly, what steps to take if you or someone close to you is currently using them. The first category is benzodiazepines. You may recognize the brand names more easily than the drug class itself: Xanax, Valium, Ativan, and Klonopin. These medications are commonly prescribed for anxiety and sleep problems. They can be effective in the short term, and that's part of why they are so widely used. However, that same effectiveness also contributes to their risks in older adults. After the age of 70, brain sensitivity to benzodiazepines increases significantly. Because the liver processes these drugs more slowly, they tend to build up in the body. A dose taken at night to help with sleep may still affect coordination and alertness hours later, for example, when getting up in the middle of the night. Multiple studies have shown that benzodiazepine use is strongly linked to a higher risk of serious falls in older adults, falls that often require hospitalization. Falls are actually one of the leading causes of fatal injuries in people over 65. This is not a minor concern. In addition to fall risk, these medications can also affect memory, attention, and decision-making, even when someone feels they have adjusted to them. Because of these risks, the American Geriatrics Society includes all benzodiazepines in the Beers criteria as medications to avoid in older adults. If you or someone you know is currently taking Xanax, Ativan, or Valium, it is very important not to stop suddenly. Stopping abruptly can lead to serious withdrawal symptoms, including seizures. This is something that should always be discussed with a doctor, with a plan to gradually reduce the dosage safely. Before moving forward, let me ask you something. Are you or someone in your family currently taking any of the medications mentioned so far or about to be discussed? Let me know in the comments. I'm interested to see how common this really is. The second medication often surprises people because it's inexpensive and widely available. It's diphenhydramine. This is sold under brand names like Benadryl for allergies, and it's also the main ingredient in sleep aids like ZzzQuil, Unisom, and Tylenol PM. Many older adults take it regularly, believing that if it's available without a prescription, it must be safe. However, that's not the case, especially after age 70. Diphenhydramine is a strong anticholinergic drug. This means it blocks acetylcholine, a key chemical in the brain responsible for memory and learning. Interfering with this chemical repeatedly over time can have serious consequences. A major study published in JAMA Internal Medicine in 2015 followed over 3,400 adults aged 65 and older for more than 7 years. The researchers found a clear connection between long-term use of anticholinergic drugs and an increased risk of dementia. Those with the highest levels of use had a 54% higher risk of developing dementia compared to those who did not use these medications. The most commonly used drugs in that study were first-generation antihistamines, including diphenhydramine. Another large study published in 2019 involving nearly 60,000 dementia patients, confirmed these findings. The evidence has continued to grow stronger with each passing year. Eleanor was 71 years old and had been taking 2 Benadryl tablets every night for nearly 5 years. Her doctor had originally recommended it as a sleep aid. Over time, her family began to notice increasing forgetfulness, repeated questions, confusion in familiar surroundings, and losing words in the middle of sentences. A new geriatric specialist later reviewed her medications and immediately identified diphenhydramine as a concern. Over the next 7 months after she discontinued it under medical supervision, Eleanor's cognitive test results stabilized and even showed partial improvement. Her daughter described it as if a part of her mother had returned. The difference was clearly noticeable. The next medication is one that millions of older adults turn to as soon as they feel pain in their knees or back. What makes it particularly concerning is that the damage it can cause to the kidneys often develops silently, without any symptoms until it has already progressed. Stay with me. The third medication is ibuprofen and naproxen, commonly sold as Advil, Motrin, and Aleve. These nonsteroidal anti-inflammatory drugs, or NSAIDs, are often the first choice for pain relief in many households. For occasional use in younger individuals, they are generally considered manageable. However, for regular use in adults over 70, the risks change significantly. The kidneys are responsible for filtering these drugs from the bloodstream. After the age of 70, kidney function has typically declined by 40 to 50% compared to early adulthood. When ibuprofen remains in a system with reduced kidney function, it stays in the body longer, has a stronger impact, and gradually damages the very tissues responsible for filtering it. The 2023 update to the American Geriatrics Society Beers criteria specifically emphasized the importance of adjusting NSAID dosages based on kidney function. This reflects how commonly this class of medications contributes to acute kidney injury in older adults. The gastrointestinal risks are just as serious. With age, the stomach lining becomes more delicate, and NSAIDs directly weaken its protective barrier. According to the NIH, older adults who regularly use NSAIDs are 3 to 5 times more likely to experience serious gastrointestinal bleeding compared to younger individuals. And these types of bleeding events are far more dangerous in people over 70. For those with heart disease or high blood pressure, NSAIDs can also raise blood pressure and increase fluid retention, which raises the risk of heart failure. This combination of risks makes ibuprofen and naproxen particularly dangerous when used daily or almost daily after the age of 70. Let me ask you, do you currently use ibuprofen or naproxen for pain relief? Comment yes or no below, because I'm going to share safer alternatives for joint pain in older adults without these risks. Coming up next, the fourth medication is prescribed to nearly 10 million Americans each year for sleep, zolpidem, commonly sold as Ambien. The FDA has issued a specific safety warning regarding this medication in older adults, noting that elderly individuals can have significantly higher levels of zolpidem in their bloodstream the morning after taking it, compared to younger people taking the same dose. This means they may still be under the drug's effects when they wake up, even if they don't feel sedated. They may feel normal, but their coordination and reaction time are impaired. Research consistently shows that zolpidem use is associated with nearly double the risk of hip fractures in older adults. Hip fractures in individuals over 70 come with a 1-year mortality rate of approximately 20 to 30%. In other words, up to 3 out of 10 seniors who experience a hip fracture may not survive the following year, often due to complications such as blood clots or pneumonia during recovery. There is also another concern. Zolpidem reduces the deeper, restorative stages of sleep while increasing lighter sleep phases. So while it may help you fall asleep faster, the overall quality of sleep is reduced. This often leads to continued use, increasing doses, and eventual dependence. It doesn't truly solve the problem. It simply changes its form. The fifth medication on this list tends to surprise more people than any other: proton pump inhibitors. Medications like omeprazole, Prilosec, Nexium, and Prevacid are among the most commonly prescribed drugs worldwide. For short-term use, typically 4 to 8 weeks, these medications are both appropriate and effective for treating acid reflux and stomach ulcers. The issue is that many older adults are not using them for just a few weeks. Instead, they remain on them for years, sometimes even decades, without any proper reassessment. Long-term use of proton pump inhibitors after the age of 70 can quietly reduce two essential nutrients in the body. The first is vitamin B12. Stomach acid plays a key role in absorbing B12 from food. When that acid is suppressed over long periods, B12 absorption drops significantly. Research published in JAMA found that extended PPI use was linked to a 65% higher risk of B12 deficiency. In older adults, a severe lack of B12 can lead to peripheral neuropathy, including tingling and numbness in the hands and feet, along with cognitive decline that can resemble dementia. The second nutrient affected is magnesium. The FDA has issued a safety warning about hypomagnesemia, meaning dangerously low magnesium levels in individuals using PPIs long-term. Low magnesium can disrupt heart rhythm and nerve function, increasing both cardiac and neurological risks in seniors. Robert was 76 years old. He had been taking omeprazole for 9 years, originally prescribed for an ulcer that had already healed long ago. Over time, he developed severe numbness in his feet and what his family described as a persistent mental fog. When tested, his vitamin B12 levels were found to be critically low. His geriatric specialist gradually tapered him off the PPI over 8 weeks, began intensive B12 replacement therapy, and shifted his reflux treatment toward dietary adjustments along with a safer alternative medication. After 4 months, his neurological symptoms showed clear improvement. A medication that was no longer necessary had gone unnoticed for 9 years, until a thorough review was done. Now, here's exactly what you should do after watching this. First, make a complete list of every medication you are taking, both prescription and over-the-counter. Yes, include things like Benadryl, Advil, and Prilosec. Just because something is available without a prescription does not mean it is risk-free. Second, take that list to your doctor and specifically request a geriatric medication review. Ask them to evaluate your medications using the American Geriatrics Society Beers criteria. Using those exact terms will make your request clear and direct. Third, for pain management, ask your doctor whether acetaminophen would be a safer first-line option. At the correct dose, it is significantly safer for both the kidneys and the digestive system in older adults. The recommended maximum is no more than 3,000 milligrams per day for individuals over 65. Fourth, for sleep issues, ask about a referral for cognitive behavioral therapy for insomnia, known as CBTI. Research consistently shows that it provides better long-term results than sleep medications without drug interactions, dependency, or next-day impairment. Fifth, if you have been taking a proton pump inhibitor for more than 6 months, ask your doctor whether it is still necessary and whether your vitamin B12 levels have been checked recently. Before we finish, an important safety note: never stop any prescription medication without consulting your doctor. Withdrawal from benzodiazepines without proper supervision can lead to life-threatening seizures. For individuals managing heart disease, kidney disease, or multiple medications at the same time, any change must be done carefully under medical guidance. These 5 medications are not automatically harmful for every person in every situation. However, in adults over 70, when used long-term without reassessment, the research consistently shows increased risk. Your body has changed over time, and your medications may need to be updated to reflect that. Now, take a moment to respond in the comments with one of the following. Type "reviewing my list" if you plan to check your medications today. Or share your age and which of these 5 medications you want to discuss with your doctor. Or simply comment sharing this if you're sending it to a parent or loved one who needs to see it. And make sure to subscribe, because next week I'll be covering 5 supplement combinations that may be quietly dangerous for older adults, including some that are being sold together in the same bottle as if they are completely safe. That video could truly help protect someone you care about.